What if you could make one change that could improve the outcomes at substance use disorder treatment centers by 200 to 300%? And if that one change increased long-term sobriety, employment, and housing, there could be a drastic reduction in the number of people experiencing homelessness. That one change is literally on the tip of your tongue and all around it. It's the brainchild of Dr. Glen Hanson at the University of Utah Dental School.
This was something that I've wanted to do for a number of years.
He's a pharmacologist, dentist, and nationally recognized drug policy expert. He wanted to do a study to answer this question.
By providing comprehensive dental care, integrating it with substance use disorder treatment, you get better outcomes on the substance use disorder side. We're going to get good outcomes with the dental because that's what we do. But does it have an impact on the substance use disorder treatment?
Through the dental school, he received a federal grant from a branch of the Department of Health and Human Services. They called the study FLOSS. They teamed up with Odyssey House and First Step, two well-known treatment centers in Salt Lake. It was a 3-year study involving hundreds of patients. While going through their residential treatment programs, one group would get comprehensive dental care, another group would not. Both groups with similar addictions and health issues. By year 2,
starting to look pretty good, and we're kind of scratching our heads thinking, this looks better than we ever thought it would. And there was a little bit of hesitancy, and there was some doubt on the part of the substance use disorder treating people. They said, this can't quite be true. And the numbers kept coming in, and they kept getting better and better and better. And then we had one of the directors of Odyssey House who came in, and she had done an evaluation of their data, and she came back and she says, crap, this is true. There is a powerful effect here.
Powerful is an understatement. The final statistics will be released soon, and they should get worldwide media coverage. This is the first study like this done anywhere. Preliminary numbers show a 50 to 300% increase in things like completing treatment, finding housing, a job, and staying sober. And so much of the success has to do with a simple thing like a smile.
Oh, the power of a smile. Well, it's their confidence. It is, it's the first impression. And if you have to hide that, and you can't, I mean, even just right now when I'm talking, I'm showing my teeth. It's a part of what we do when we interact with people. And it's very powerful.
Destiny Garcia recently graduated from Odyssey House. Before she came in to deal with her drug addiction, this is what her mouth looked like.
I wouldn't smile. I would smile with my mouth closed. And I would try to keep my mouth closed as much as possible as I talked.
Why?
Because it was gross.
But she got her teeth fixed with the floss study. Now she's sober and successful, even landing a job in the Salt Lake County Mayor's office.
I feel like I'm worth more now. I feel like I carry myself better, my confidence is better. Without my teeth, I felt down in the dumps a lot. I feel like I was being judged. I wasn't confident in myself at all. It made me feel like crap not having teeth.
Carl Henry lost a lot of teeth through drug use. This was his mouth's x-ray. Almost no teeth, robbing his soul of his old confidence.
When you notice, then the imperfections start coming, and then you're just like, okay, you don't want to be in people's face. You're doing a lot of this, turning around, maybe, smiling, doing this, and then up until you're doing a bitter beer face.
This is Carl now. What a difference. He is successfully completing the Odyssey treatment program, and thanks to floss, he has his old spirit back.
Now it's wonderful. I love it. I'm super confident now. Like I said, I've got a lot going on, good things are happening.
It would stand to reason that if people who are homeless and using drugs on the street got the same kind of comprehensive dental care combined with a treatment program, homelessness would begin to dissipate. That's why 4th Street opened its dental clinic in 2014, trying to deal with the same things as the floss program, the very same issues.
It's the constant reminder of where they've been. Their teeth is a constant reminder of where they've been, whether it's been drugs or been on the street, that neglect. And so they feel like if they could get their teeth restored or fixed or replaced, that would be the final barrier to pull them out of homelessness.
4th Street treats about 1,200 patients a year, including Pat Roach, the man in the chair right now. He was one of their very first clients 4 years ago.
It means all in the world just to be able to sit down and eat a regular meal without having to worry about anything, you know. And it's a godsend, literally. I mean, they're so great here.
Getting them out of pain and restoring their dentition to not only aesthetically pleasing but functional allows them to say, okay, I can do this. I can endure something and not have to worry about, you know, the pain in my mouth. I can go off, you know, heroin. I can start to try to wean myself off of alcohol, and I don't have to pre-medicate myself.
Back at the U, comprehensive dental care combined with evidence-based substance use disorder treatment seems to be a rather basic solution. Ironic, since both the medical and treatment professions have been searching for a so-called magic pill for decades.
Or we'll find this magic medication, we'll give it to them, and their addiction will go away. Well, we do have some medications that we prescribe, and if they improve the outcomes by 20%, we think we've died and gone to heaven. You can get Nobel Prizes for improving outcomes in drug abuse by 20%. And here we have this strategy that improves it by 200% and even 300%. It's like, wow, what is going on here?
Okay, so it works. Why not provide this for everyone in treatment? Well, funding for the floss study is ending. Dr. Hanson and other professionals persuaded Utah lawmakers to include comprehensive dental care for Medicaid patients who are homeless and in treatment programs. They are still waiting for a waiver from the feds.
Dental care should be a part of basic health care because it involves the whole body and it impacts the whole body.
I've seen people who, before their teeth and after their teeth, and they are new people. I think a program like this should continue to go on and on and on.
I mean, I couldn't imagine, you know, don't even want to get into what floss has done for everybody. I know, I could just know what they've done for me, and so I could just imagine, like, cost and all that, and so what they're willing to put time and effort into helping people feel good again.
And naysayers will no doubt be asking, what about paying for this?
I think the average cost of these patients was about $1,500. If I can spend $1,500, bring their mouth back into good health, and improve the likelihood by 2 or 3-fold that this person will get off their drugs and stay off their drugs, well, you're saving $40,000, $50,000 a year in terms of treatment, keeping them out of jail, getting their families back, keeping your kids out of the social system of government. And guess what? You pay taxes because you have a job. So it's a small investment for an incredible outcome and a dividend that just pays and pays and pays for the rest of this person's life.
$1,500 to help reclaim a life. Think about that.